For individuals undergoing chemotherapy or radiation treatment, obviously you're thinking about the condition you're getting the treatment for, but it's also important to know how those treatments can impact your oral health. And today we have Dr. Pashmini, who is going to run through that with us, a very important topic today. Welcome, Dr. Pashmini.
Thank you.
So a lot of individuals going under chemotherapy or radiation treatment, what do they know about how that can impact their oral health?
Of course. So with chemotherapy and radiation, both are affecting the very fast dividing cells in our body. Obviously, we want that treatment to get to the cancer cells to stop the cancer, but chemo does not discriminate. It also goes to the hair cells, it goes to the salivary glands. And salivary glands obviously has complications in dental world because then you get dry mouth. We get a lot of dry mouth complications from just simply chemotherapy. The good thing about chemotherapy is once the therapy stops, usually a lot of these symptoms will improve. It's not lifelong effects, hair grows back, the dry mouth can be improved. But while patients are going through that treatment, it can cause complications. Usually if you have existing cavities or problems with your teeth, they are going to get worse. To add to that, usually nausea, vomiting, things like that can really take a toll on your oral health. We have patients who cannot floss or brush their teeth while they're going through chemotherapy because of how irritated their mouth feels. Dry mouth feels red, it feels inflamed. They have dietary restrictions. So it's important to fix things before you start treatment. See your dentist, make sure at least as much as can be fixed ahead of starting chemo can be fixed so that you're not dealing with all of that. So hopefully you just see us for an extra cleaning a year to make sure teeth are okay. We also highly recommend fluoride trays for patients who are going through that. Again, fluoride helps remineralize the teeth, keep the cavities at bay so that you don't come out of chemotherapy with a lot of dental issues to fix. A bigger problem could be radiation treatment. Again, it is good because it focuses on the cancer cells and it kills the cancer cells, but it does have a very unique complication in the jaw bones, especially the lower jaw for the patient. What it does, it prevents the jaw from healing. So anything that involves the bone, let's say you end up having a tooth extracted while you're going through head and neck radiation or any sort of radiations that's close to the head and neck, it is actually going to affect the way the patients heal. It's called osteoradionecrosis of the jaw, and it's something that you don't see it in any other bones in the body. It's not like if you break your arm, it's going to not heal. Usually that's fine, but we see it a lot in the jawbone. So that's why, again, the importance of seeing your dentist before you start any of these treatments. There's also chemotherapy medications that are from the class of bisphosphonates, like IV bisphosphonates. They're very much used for metastatic cancer treatment. Again, does the same thing, delays healing in the dental world. So anything you get done, it just doesn't heal as well if it involves the bone. So those are the things we want to know about. We want to fix them before you get started on any treatment and hopefully just maintain the health throughout the treatment.
Gotcha. So proactive treatment. So obviously chemotherapy and radiation treatment, we're thinking about a lot of things in life. I wouldn't say oral health comes to mind, but it's important, just as you outlined. I did not know about the jawbone, and that's very insightful. So for folks going through that, talk to your dental professional. If you're a patient of Dr. Pashmini, she's here to help you out. So insightful as always. Appreciate your time.
Of course. My pleasure.
Thanks.
Thank you.